Mirena Coil Insertion for birth control. The Mirena Coil, also known as the Mirena Intrauterine Device, IUD, is a highly effective and long-lasting contraceptive option for individuals seeking reliable birth control. Here, we will provide a detailed description of what to expect during the Mirena Coil Insertion procedure. 1. Pre-procedure consultation. Before the insertion, you will typically have a consultation with your gynecologist to discuss your contraceptive needs, medical history, and any questions or concerns you may have about the Mirena coil. 2. Timing. Mirena is usually inserted during your menstrual period when your cervix is naturally more open. This can make the insertion process more comfortable. 3. Sterile environment. The procedure is performed in a sterile environment, often in a healthcare provider's office or clinic. 4. Positioning. You will be asked to lie down on an examination table with your feet placed in stirrups, similar to a pelvic exam. 5. Cervical examination. Your gynecologist will start by performing a pelvic examination to assess the size and position of your uterus. 6. Cleaning and anesthesia. The provider will clean the cervix and vagina with an antiseptic solution to reduce the risk of infection. They may also use a local anesthetic to numb the cervix to minimize discomfort. 7. Measuring the uterus. A special instrument is used to measure the depth of your uterus to ensure that the Mirena coil is placed correctly. Insertion of Mirena coil. The Mirena coil is a small, T-shaped device made of soft, flexible plastic. Your healthcare provider will use a thin tube or inserter to guide the Mirena coil through the cervix into the uterus. Dr. Champika Gihan, a consultant in obstetrics and gynecology in Kandy, Sri Lanka, shows how to put in a Mirena coil.
Is it drug-eluting or just?
These, levonorgestrel and progesterone. Levonorgestrel progesterone releases a minute amount, 20 mics per day over a period of 5 years.
For 5 years?
5 years.
Yes, then why?
Long acting. That is the main advantage.
Once inside the uterus, the arms of the T-shaped device will open up, and the device will release a hormone called levonorgestrel. Once inside the uterus, the arms of the T-shaped device will open up, and the device will release a hormone called levonorgestrel. 9. Checking placement. Your gynecologist will confirm that the Mirena coil is properly positioned within your uterus using ultrasound or other imaging techniques. 10. Trim excess strings. 2 small strings attached to the bottom of the Mirena coil will hang down into the upper part of your vagina. These strings are used for future removal of the device and are typically trimmed to the appropriate length. 11. Recovery. After the procedure, you may experience mild cramping, spotting, or discomfort. These symptoms usually subside within a few days. 12. Follow-up. You should schedule a follow-up appointment with your gynecologist to ensure that the Mirena coil is in the correct position and discuss any concerns or side effects. The Mirena coil is effective at preventing pregnancy for up to 5 years, and it can be removed at any time if you decide to discontinue its use or if you wish to become pregnant. It's essential to discuss your contraceptive options with an experienced gynecologist to determine if the Mirena coil is the right choice for you, considering your unique medical history and preferences.